You've got to be on the lookout for tricks tomorrow. It's April Fool's Day, you know. April 1st is also National Walking Day, so be on the lookout for events locally. They're all designed to get us all moving more. Here to explain how physical activity affects heart health, cardiologist Dr. Scott Carollo, I'll get it, and then John Clark, a little bit easier. He's the Heart Walk team captain. It's nice to have both of you here.
Thank you.
So what's planned tomorrow, John?
The heart event, for the walking event for April 1st, and I think you have the details of where that's at.
We've got 3 venues or 3 sites for it, and we'll show you this information. Why do you want the community to take part in these different events around the city, Doctor?
The important reason why is we have to have an understanding about what the #1 cause of death is in this country, and that's heart disease. And a big factor in that is improving our lifestyle. We've got to get more active, we've got to eat better, live a life of more moderation, but activity is key.
Our viewers aren't coming from 7 to 1 straight, or are they? Can they just pop in and out at their convenience between Oakview Mall, West Roads, and the Jean Leahy Mall?
Absolutely. It's a great event. It's open to everybody, minimal cost, a lot of opportunity for education and involvement. It's a great opportunity.
Why is walking a biggie? Because I think about really needing to get the heart pumping, get on a treadmill or something, but why is walking effective?
You know, that's an interesting point because I always hear that from people. They get overwhelmed, I think, with this idea when you say, well, be active, exercise. We immediately go into this thing where we think, oh, I have to be a triathlete. It's not the case. Just get up and move. The American Heart Association recommends just being active for 30 minutes, which basically means get up and walk. And I don't think we take appreciation for that as much as just get out and move. And I don't think we do that as much as we could, and if we did, it would make a big impact.
Well, 30 minutes of walking a day is doable, especially since people are wearing all these fitness trackers now. It makes it a bit easier.
Absolutely, and you don't have to be on TV late night with an infomercial buying some crazy equipment or something like that.
Hey, John, what's your story, your heart story specifically?
Well, I'm a survivor. September 1st, 2012, I experienced what they call the Widowmaker, which most people don't survive.
Familiar with it, yeah.
And because of the knowledge that I had and the experiences I'd had in my lifetime, I knew what to do. I knew what actions to take, and thanks to a lot of folks and medical folks, it saved my life.
Had you any symptoms leading up to the event?
I did. Up to the day, I had none, but that morning, I was doing some landscaping work, finishing some landscaping that I'd started throughout the summer, and I got a burning, almost like an acid reflux in the chest. I knew the symptoms, that was one of them. I sat down, it went away, I got back up, it recurred right away. So I knew that I was having a heart attack from the knowledge that I had gained from studying that over the years. And so I went and took some aspirin. I had been coached to do that, make sure that would help. I alerted my wife immediately. Fortunately, I don't live too far from the hospital, so that was at 8:30 in the morning, and by 10 o'clock I was in surgery.
Wow. So what can we do to reduce our risks? It sounds like he was doing a lot of things right. For all of us, what can we be doing better?
Yeah, I think it's important to understand, be educated, know about symptoms, but I think living a lifestyle of moderation is really important. Eat healthy and be active. Those are the things that I think are going to make an impact on people, and they're very capable and available to all of us.
Is it ever too late? Because I've heard that from some heart patients in my own family where they felt like, listen, I'm 70 years old, there's no sense in trying now. What do you recommend as a cardiologist?
Absolutely not. I mean, obviously it's better if we start to incorporate this into all of our daily routines as a younger person, but I think getting started at any time is going to be critically beneficial.
And for men and women specifically, what are the differences between us in terms of the warning signs, like what he described in his own life?
Yeah, I mean, women tend to manifest heart disease a little bit more differently than the textbooks write about. But people will pick up on symptoms. Everybody knows their body and starts to realize, hey, I'm not feeling right. I'm a little bit more short of breath. I'm more fatigued. I'm not doing the activities that I could do previously.
So we have National Walking Day coming up, but I know you do something throughout the year, and you offer up these lifetime memberships into a club to help make exercise and activity fun.
That's right.
For seniors primarily. What is this?
Well, it's just a minimal fee, $10 fee that offers an opportunity to be involved in this fitness program. Again, have an opportunity to meet healthcare professionals, have blood pressure assessments, and an opportunity to engage people and get educated.
And I think to meet some friends too. That's something else we talk about with fitness at any level, is to have a buddy. That way you're not bored and then you lose focus. So if you're meeting other people who are in a similar position, then maybe you're grabbing your shoes every other day and you're going out and you're walking together. But Heart and Soul is the name of this program, and it's $10 throughout the lifetime of the individual. That's not a monthly fee.
And I'm providing a prescription for the feet, and it's a lifetime of refills with no questions asked. So
I
it
like
should be
your
very
kicks.
easy.
Yeah, you both have sneakers on today. I'm
We're ready to
noticing.
go.
Yeah, I got to
like
get
your
them broke
stuff.
in and ready for the heart walk.
Yours are
today.
still very clean.
How about that? It won't be for long, I'll guarantee you.
And let's show you some information about that event tomorrow. If you would like to take part in National Walking Day, the American Heart Association bringing this to us locally. So we'll break it down between Oakview Mall and Westroads Mall, and the times there 7 a.m. to 1 p.m. If you'd rather take part downtown, if you live or work closer to Jean Leahy Mall, that'll be from noon until 1 p.m. We are proud to spread the word about the American Heart Association here on the Morning Blend, not just in February, right? We think about Heart Month, and sure, there's a lot that happens then, but throughout the year to really be part of the mission and to help save lives, because you mentioned it, the #1 killer.
Absolutely.
It's no joke, but the more we know, the better we can take care of ourselves and our loved ones, and for that, we encourage you to visit heart.org/Omaha. John, thank you. Dr. Carollo,
Yes.
thank you.
Well done.
Got it, but Italian here, so even though Mike's not here, we've got another one. Great to meet you. Yesterday, we welcomed